This is Anuhya Konte. Today I am going to talk about an important economic issue in India, which is the infrastructure. Let us discuss its challenges and the way ahead. To introduce, good social and physical infrastructure facilities are crucial for rapid economic growth, rapid human development, and poverty eradication. Given the urgent need for rapid development of a social and physical infrastructure, let us try to identify key challenges to infrastructure development and discuss some possible ways in which some of these challenges can be addressed. A country's level of human and economic development is closely related to its levels of achievement in physical and social infrastructure. While physical infrastructure is an important determinant of domestic production, good social infrastructure is vital for human development as well as economic progress through better educated, better skilled, and healthier citizens. In spite of some improvements in infrastructure in recent years, India still ranks 89th in basic infrastructure as per the Global Competition Report 2011 to 12. This implies that major improvement in physical and social infrastructure is absolutely essential to sustain further progress and high rate of growth. To meet this need for improvement, the Government of India raised the investment in infrastructure from 4.7% of GDP to around 8% in the 11th five-year plan, and further plans to double the investment infrastructure from INR 20.5 trillion to INR 40.9 trillion during the 12th plan period. This raises the share of infrastructure investment in GDP to more than 10%. If these infrastructure investment plans are properly implemented, they can propel India's economic growth to a higher trajectory. Given the importance of infrastructure in the economy, we compare the levels of development of social and physical infrastructure in India with those in other emerging countries as discussed. Let's start with key challenges in the education. Number one, investment in public education is still limited. The government of India spends far less on education than other emerging and developed countries and less than even its own assessment calls. For example, the Central Advisory Board on Education has consistently argued that average annual expenditure on education from the public exchequer has to be in the range of 6% of GDP, at least half of which should be for primary and secondary schools. Number two, elementary education is still not universal. While close to 93% net enrollment ratio children in the age of 6 to 11 are formally enrolled in primary schools, nearly 40% have dropped out in the primary stage. Number three, education quality remains low. Now, notwithstanding the rapid gains in enrollment and attendance, average levels of educational attainment and basic skill acquisition, including reading, writing, and basic maths, remains very low compared to international standards. As participation rates continue to rise, the priority will need to shift focus on learning outcomes of students. To summarize, while the central and state governments have been devoting substantial funds and public effort towards provision of education, these efforts have not been adequate nor have they yielded the desired results. The aspects of policy failure could be categorized as follows: attention to the challenges posed, and delivery mechanisms are poorly designed, implementation of the policies and schemes is poor, appropriate institutional mechanisms needed to bridge gaps which are absent, and institutions do not appear to be adequately answerable for the failure of delivery system. For overcoming the challenges in the education, we can do certain things. Number one, improvement in infrastructure and institutions. Improvements are not possible if the quality of infrastructure is poor, but they're even more unlikely if institutions are weak. Therefore, improvements can be brought about by expanding facilities and improving the delivery mechanism. Number two, offer school health programs. Along with the midday meals, health programs should also be introduced in schools to cover basic health care, including deworming and iron supplementation. The WHO has identified worm infections as the greatest cause of disease among 5 to 15-year-old children, and programs have to be taken care of. Number three, educating girls and mothers. Educating them leads to sustained increase in education attainment from one generation to the next. It can change society from one in which not sending one's children to school is socially acceptable into one in which the expectation is that every child completes their school. Number four, address special needs. It is also important to go beyond average and, disaggregate results by region, gender, and ethnic group and socioeconomic status to identify weaknesses. This will help in formulating direct policies aiming to bring improvement in the lower castes or Dalits, Muslims, and people with disabilities, etc. Number five, evaluate learning outcomes. Number six, create better institutional mechanism for more effective delivery. Number seven, the removal of challenges in the higher education. Therefore, to promote quality, governance needs to be reformed, curriculum revised, and accreditation mechanisms developed. Colleges should provide credit and non-credit courses in the form of employment and non-oriented. Starting with the health sector, health services in India are characterized by inadequate and inferior infrastructure, poor public service delivery, and lack of access for poor, etc. So, let us discuss some challenges and how they undermine the expected impact. Number one, public expenditure on health is too low. The WHO calls for 7.5% allocation of GDP for health. Today, India allocates only about 1%, less than even Nepal and Thailand, and reaching its avowed target of even 3% of GDP seems difficult. Number two, adverse impact by user fees and privatization of health sector services. Possibly the singlest large cause of putting health services out of the reach of the poor is the introduction of the user fees in public hospitals by the government. 1990 privatization of health sector. Since then, the penetration of market in the sector has been damaging consequences for the poor. Number three, focus on women is needed. Patriarchal functioning has ensured that health for women normally means maternity services, excluding basic health services that lie at the root of many a problem. Along with the gender budgeting, services need to be integrated into comprehensive primary healthcare system as conceived by the Alma Ata Declaration. Number four, poor institutional structures. Let us discuss on a few points on how we can overcome the challenges in the healthcare sector. Number one, improvement in infrastructure and institutions. Improvements are not possible if the quality of physical infrastructure is poor, but they're even more unlikely if institutions are weak. Studies reveal that public infrastructure for poor healthcare in India is of poor quality and inadequate to meet the full demand. Let us see some points on how we can improve overcome the challenges. Number one, public expansion on health. The government should aim to increase public expenditure on health to 2 to 3% of GDP from the current 1% is already discussed. Number two, planning around the poorest. This government must prioritize the needs of traditionally marginalized groups in planning its investment and outreach. The poorest districts of the country and the most vulnerable groups, including women, children, people with disabilities, and communities like the Dalits and tribes, etc., must be the focus while planning infrastructure and allocating resources. Therefore, users' fees should also be eliminated for the very poor. Third, uniform quality of service. The quality of health is a crucial sector in ensuring the achievement of human development outcomes intended for the services. Let's now discuss the points that we can use to overcome the challenges in the physical infrastructure department. Number one, land acquisition. Earlier, the government had made cabinet approval mandatory for leasing or licensing or transferring the land. This has led to long delays in the concessions being awarded for infrastructure projects. Recently, by relaxing transfer regulations, this has been taken care of. So, the government is expected to follow up with land acquisition policies or guidelines for project authorities and sponsoring agencies. By number two is also by introducing fast track policy and regulation reforms for enhanced implementation. The third party audit should be a mainstream activity for planning and executing infrastructure projects. Number two is dispute resolution. At present, dispute between parties are one of the major causes of delay in the projects, and therefore most cases go into further litigations. And so, to eliminate this issue, a performance review unit should be given powers to gather information from model agencies and on clearances and incentives or regulate this. Number three is facilitate funding for the projects. The 12th plan has aggressive investment targets, with at least 50% of the investment proposed to be contributed by the private sector. And these need to be fast tracked and will go a long way in creating a mature financial market for facilitating investment in infrastructure. Fourth point to overcome the challenges in physical infra are the public private partnership. So, allowing the private sector into some powerful, from some form of fully government owned infrastructure sectors, such as telecommunications and domestic civil aviation, this has produced some exemplary results, and hence a significant implementation problem has been the need to obtain cabinet approval for road contracts. Therefore, grid authority should be delegated to the highways authority to speed up the process. If proper effort is made in expanding education, health facilities, and physical infrastructure by improving their quality, by increasing budgetary allocation, and improving governance, it will go a long way in reducing poverty, improving human development, and reviving and sustaining high rates of economic growth in India. Thank you.